We had the definition accordingly with the pharmacology. We always emphasize that this is the science of drugs. And with the concept of science, it always consider properties, actions, therapeutic use. And it is very important for a nurse to have the high confidence to promote medication safety because it is the highest priority for the welfare of our patients. And we have also discussed yesterday the divisions of pharmacology, wherein we have identified mainly what pharmacology uh, is and divisions such as pharmacokinetics, and we referred it as for the movement. The pharmacodynamics, we refer it to the mechanism. Pharmacogenomics, we refer it to the makeup genes, and pharmacotherapeutics, we refer it to the maximum. So as we continue with our discussion today, we had already yesterday the self-assessment exercises. So all these answers had been rationalized and revealed its explanation, and our session was productive simply because all of you have maximized your participation as well. So for this evening, we will have the discussion mainly on the pharmacokinetics. Actually, we have defined the pharmacokinetics as movement. So that's why we have already identified the mechanism and the processes involving pharmacokinetics. Actually, we have started it with how this drug enters the body and how it will act upon until it reaches prior to the distribution to the body and will cause its physiologic and chemical change to our body. So these were the one that I'm showing to you now are the terms and the self-assessment exercise that we have discussed yesterday. So before I proceed with the topic for today, do you have any question to the topics that we have discussed yesterday? So can I have your thumbs up if you don't have any questions? So you may use the emoji thumbs up if you don't have any questions. Feel free to raise questions using our chat box. Okay, thank you very much. So for today, we'll start with the pharmacokinetics, and we will start with the audiovisual presentation of what pharmacokinetics is. So let's play the video.
Hi, this tutorial is the first in the Pharmacokinetics series. So first of all, I should talk about what pharmacokinetics is. Within pharmacology, we often talk about two distinct, but unfortunately unintuitively named branches. These are pharmacokinetics and pharmacodynamics. Briefly, pharmacodynamics is the study of the effects of drugs on the body. That is, what does this drug do to the body? What receptors does it activate? And what other effects does it have? Alternatively, pharmacokinetics is the study of the effect the body has on drugs. In pharmacokinetics, we ask questions like, how does the drug get into the body and where does it go? What does the body do to the drug? And how does the body get rid of the drug? It is this branch of pharmacology that we will be looking at in this series. So let's begin with a pharmacokinetics acronym you'll find in every textbook of pharmacology. ADME. A-D-M-E. This stands for absorption, which is how the drug gets into the body. Distribution, which is where the drug goes to in the body. Metabolism, which is how the body chemically modifies the drug. And finally, excretion, which is how the body gets rid of the drug.
So again, it is mentioned accordingly the ADME. So as we recall, what has been mentioned in the audiovisual presentation, that the absorption considers how the drug is processed inside the body. Distribution is where the drug will take its place, or the where the drug will take place when it comes to its action. The metabolism is on how the body will act, and excretion is on how the body will respond to remove excess chemical composition of the body. Let us continue.
These are 4 elements we need to consider when talking about the pharmacokinetics of a certain drug. The following tutorials will each talk about a certain aspect of pharmacokinetics. But for the remainder of this tutorial, we are going to discuss some of the more boring but incredibly important aspects of pharmacokinetics and pharmacology. So I'll begin by drawing a graph. And here on the y-axis, we have the concentration of drug within the body. And on the x-axis, we have time. So if we give a person a drug at time 0, then we will see the concentration of the drug go up, and then it will fall slowly as the drug is removed from the body. And that's what we see on this graph.
Okay, in those explanation of how the drug takes place or probably act on the body, it is on the perspective wherein it considers the line graph that it was explained in the audiovisual presentation. And this considers on how the concentration of the drug is associated with the time. Okay? Once the drug enters the body, then it will proceed to its peak concentration level. If we say peak concentration level, this considers on how the drug really takes place when it comes to the perspective wherein as it enters the body, it will lead to the point that this drug will really consider its action already, and it already affects the body. Now, when the time reaches the peak concentration level, once we talk about peak concentration level, it is the time that the drug already reaches the plasma, which is the plasma is part of the blood. Now, from the time that this chemical component of the drug is already carried for distribution by the plasma, as what I have mentioned, it may reach to the point that it will decrease the concentration level because not all the 100% of its chemical component will be useful to the body. So that's why the body may need to have a excretion. That's why the concentration level goes down. So that's why it is represented by, it is definitely represented by a loop. Okay. For a while, I'll just have this unshared muna, stop sharing because the video is not working. So I'll just continue with my other. Okay. Sorry for the inconvenience. We're having problems with the sharing of the PowerPoint because the video is not playing. Okay, for a while. So as what I have mentioned, this will consider specifically on how these drugs are taking place into the body. So let's start again. One that I will share. Okay. Okay. So it seems there's a problem with, I'll just close it. But anyway. So there's a problem with sharing of my file. So I'll just have it open again. Okay. Okay, that's it. Okay, let's proceed again. A while. Okay, let's share. Okay. Okay, let's go back to the video presentation.
Video, as we will use terminology which was introduced.
Okay, for a while. This one is the video. Okay, so there's something wrong with
The body.
Okay, let's proceed to
We
the
ask questions like, how does the drug get into the body and where does it go? Let's begin with a Pharmacokinetics acronym you'll find in every textbook of pharmacology. How the drug gets into the body, excretion when talking about the pharmacokinetics of a certain drug. The following tutorials will each talk about a certain aspect of pharmacokinetics.
I'll just
And
move
here on the
forward.
wall.
Okay.
So if we give a person,
This is the time that we ended up with our video presentation. So we have the concentration of the drug and we have the time. So we have the zero concentration and the zero time. Once the drug enters the body, then it will reach to the point that the drug must reach the plasma. So that's why it increases concentration of the drug. Once it reaches the concentration of the drug, it will basically increase to this is what we call the peak concentration level. If we say peak concentration level, the drug already reaches the blood plasma. And once it reaches the blood plasma, it will undergo the process of metabolism and excretion. Once it will process the metabolism and excretion, then if you will notice, it will decrease the concentration of the drug. This may depend also, or it could be directly associated with the time. So let us continue on this.
and that's what we see on this graph. So looking at this graph, we can see that in this section, the drug enters the body faster than it is being removed from it. Therefore, the concentration of the drug in the body increases. Then, after the peak of this graph, the drug is being removed from the body faster than it is entering.
Okay, if you will notice, more drug in. Ibig sabihin, this is the time from zero, it reaches the peak, then it reaches the blood. So that is what we call the peak concentration. You will notice this is the center. Okay, once it reaches the peak concentration, more drug out than in. That means that the concentration level now will decrease because some of the chemical components or composition of the drug will be out of the body. Let us continue.
So the concentration of the drug in the body starts decreasing. This point at the top of the graph is important because it is the highest concentration of drug in the body. Therefore, we call this the maximum concentration, or Cmax. This is important because knowing the maximum concentration can help predict the therapeutic benefit and also the likelihood of side effects.
Okay, if we mention the topmost level, that is the maximum concentration or the peak concentration. If we say peak, it's the highest level. So again, as it continues, it will now decrease its concentration based from the time. Let us continue.
The time at which the maximum concentration occurs is called Tmax. Now, a slightly more confusing concept is the half-life of a drug. The half-life is, by definition, the time it takes to remove half of the current concentration of drug from the body. So let's consider.
Okay. From the time that the drug enters the body, it will increase its concentration, as what we have mentioned, until it reaches the blood. So once it reaches the blood, this is considered as the maximum concentration or the peak concentration, and this is the maximum time. Once it reaches the maximum time and the maximum concentration or the peak concentration, that is wherein from the time zero, from the concentration zero until this time of the peak of the concentration and the maximum time, this is the what we call half-life of the drug. What does it mean? It means the drug already managed to metabolize the half-life or the 50% of the composition of the drug. So that is what we call half-life.
The half-life on this graph. If we begin at Tmax, we want to see how much time it takes for the concentration of the drug to decrease from Cmax to half of Cmax. So here is the half Cmax line here. And therefore, the half-life, which is often denoted T half, is the time between Tmax and where I've drawn T half here.
So the one that is being considered as the half-life, if from 0, it reaches the peak, that is the peak concentration or the maximum concentration. And that time also that we consider is the maximum time. So meaning the half of the concentration of the drug is the half. Okay, we have the half concentration, and the time itself that we consider also here is the half time. So that's why it is called as half-life. So again, we are considering that the drug is already 50% taking its effect in the ADME, absorption, distribution, metabolism, and excretion on pharmacokinetics of the drug. Let us continue.
So just to summarize, the time it has taken for the drug to drop from its maximum level to half of its maximum level is the half-life. On this graph, this is the time between Tmax and where I've drawn T half. There's a lot more to talk about with half-lives. Including rate laws and orders of reactions. But that is beyond the scope of this video, so we'll talk about that in a later tutorial. The last thing to look at is the area under the curve, and this I have illustrated by shading in the space under the graph. This represents the total exposure to a drug that the body receives. This is a function of how high the concentration of the drug gets, as well as how quickly it's excreted. And that's an introduction to the basics of pharmacokinetics. In the next video, we'll look at routes of drug administration and how different routes can affect Cmax and Tmax.
Okay, so let's have again a review of what has been shown in the video. The pharmacokinetics starts with ADME, absorption, distribution, metabolism, and excretion. Now, this graph, the line graph, represents how the drug processes the ADME. From the time and concentration 0, when the drug enters the body. So probably it starts with A, absorption. As the drug is being absorbed in the body, the concentration level and time of the drug also increases. Because as what we have mentioned, if you have browsed the remaining part of our learning resource material, you have noticed that the fast action of the drug takes place when the drug is given intravenous, because we have mentioned that once the drug already reaches the plasma of the blood, it means we are assured that the drug is already taking its effect for distribution. While if the drug is taken orally, it will still pass through the gastrointestinal tract. So meaning, since it will pass the gastrointestinal tract, it will need more time before it reaches the blood vessel and reach the plasma. So what's the conclusion? The conclusion on that concept is basically if the drug reaches directly to the blood, the higher chances that it is already having its effect. The longer the time reaches the blood or the plasma, the longer the time that the drug is taking its effect. That's why it gives us the idea that the intravenous drug has a fastest concluded effect because it reaches directly to the plasma. Unlike for the oral, it passes pa through the gastrointestinal from the stomach before it reaches the small intestine and be absorbed by the blood vessels and reach the plasma as well. So in this situation, we have considered the zero as zero concentration and zero time. From the absorption, this is the time that it increases the what we call concentration of the drug, and at the same time, the time frame while the drug is increasing its concentration. Once the drug reaches its peak, the time we're in that we're consider is the maximum time, and the concentration that we are referring is the maximum concentration or the peak concentration. So we have mentioned that if the drug already reaches the plasma, that's the time that it will now process the M and the E. It will process naman the metabolism and excretion. So meaning that's the time that it will start to decrease the concentration of the drug, but it is still associated with the time. So from the time that the drug reaches its peak and the time reaches its peak, the half of the concentration of the maximum concentration and the half of the maximum time is the what we call half-life. Meaning, from the term itself, half, it is concluded that the 50% of the drug is already taking its effect. That's why, class, for example, if the drug is prescribed to be administered at 8 o'clock and the drug must supposedly be administered with the next dose at 12 noon, please take into consideration that you must administer it in 12 noon. If not, you administer it, for example, at 2 o'clock instead of 12 noon, do you think it will affect the half-life of the drug? The answer is yes. Because from 8 o'clock to 12 noon, it already reached the peak concentration level, meaning it also reached the what we call 50% of the effect of the drug. Meaning, what is the purpose? Why do we need to give again at 12 noon so that to supplement and support the 50% that had been lost by the body through the metabolism and excretion and may have the continuous effect of the drug. I know for a fact that you have heard this, that there are some antibiotics for some who have decided to discontinue have not reached the total treatment or recovery. Why? Because the drug, as per decision of the individual, was discontinued instead of supposedly completing it for 7 days or having its completion for 24 hours. So that's why always inculcate into your mind that please administer the drug according to its time, because that is directly associated with the concentration of the drug. Versa, if you will not give the drug to its indicated time, it will affect the concentration. Moreover, it will affect yung expected the side effect of the drug. So that is merely the simple principle that we are talking about. So the next is, since we have talked about pharmacokinetics and we have mentioned about the 4 stages of drug movement, usually if we talk about the movement of drug across body membranes to reach its target organ. So before it will reach to the target organ, and that is what we call pharmacodynamics, it will end up to metabolism and elimination. Because class, always remember, as according to most of the pharmacology book, all oral medications will pass through the liver and the kidney. That's what we call first pass effect. All oral medications will be considered basically on the 50% effect before it reaches to the metabolism with the metabolism, and this will consider yung reaching its target organ after it considers pharmacotherapeutics. So di ba we have started pharmacokinetics, pharmacodynamics, pharmacotherapeutics. So sa pharmacokinetics, it will end up to metabolism and elimination because that is the time that the liver will take place on eliminating through metabolism the decreased concentration of the drug and remove out of the body. If this will not be removed, this may lead to the possibility of toxic effect. So that is how the body balances when it comes to drug reactions. So since we have mentioned about the ADME, we will continue on what we meant by pharmacokinetics. On absorption.
Hi, this tutorial is the second in the Pharmacokinetics series. And in this video, we're going to have a look at absorption, or more specifically, routes of drug administration. If you haven't seen the previous tutorial, I highly recommend watching it before continuing with this video, as we will use terminology which was introduced and defined in that tutorial. So I'm going to begin by drawing a very simplified body plan. And this body plan follows the flow of blood from the digestive system to the arterial circulation. So let's see how this happens. So blood flows from the gut to the liver via the hepatic portal system. Blood then flows from the liver back through the venous circulation and into the right side of the heart. The blood then flows through the pulmonary arteries to the lungs. Then from the lungs back to the left side of the heart, then out into the aorta and into the arterial circulation. What we are going to do is place drugs into different parts of this system and measure their concentration in the arterial circulation over a period of time.
Okay. If you will notice, when the drug takes place orally, it will start with the GUT. Okay, with the gastro. Then once it reaches the gastro, that's the time that the liver will have its function to balance through the what we call first pass effect or detoxification or elimination of the excess chemical composition of the drug. Once the metabolism and elimination have already processed, diba, as what I have told you, the drug will reach the blood vessel. And the plasma of the unoxygenated blood takes place. So from the plasma, it goes through the vein, follows through the right side of the heart. Then after the right side of the heart, it goes to the lungs, right? And it becomes oxygenated, but the drug is still there. It is still in the plasma. Then the oxygenated drug goes to the left side of the heart. As it goes at the left side of the heart, it reaches the aorta. And that is what we call the artery. So still with the oxygenated blood, the plasma is there, the drug is still being carried by the arterial system. And that's the time that it will pass through na dun sa tinatawag nating pharmacodynamics. So this is a simple analysis that the basic knowledge pertaining to circulatory or circulation rather, or the action of the organs in the circulatory system is very much significant in the foundation of the pharmacokinetics. So we will now understand if there are drugs that possibly, because we have drugs that are what we call intracardiac. If you say intracardiac, the drug can be administered directly to the heart. If you will notice, if it will be directly to the heart, there is a shorter pace of the drug will be distributed. So from the heart to the lungs, so the heart then reaches the artery. So it means that the drug will, once it reach closer to the arterial system, has its time frame also that is past its when it comes to its effect, as what I've told you, and that's the time that once it reached the plasma, that is already the hint that the drug is already taking place. Now, if the drug is given intravenously, this is wherein we identify the vein. So if it is given in the vein, it will be carried by the venous blood via plasma, pass to the right side of the heart, pass to the lungs, pass to the left side of the heart, and it reaches to the artery. So meaning it will not anymore reach yung first pass effect of the liver. If you will notice, we have administered the drug directly to the vein. Kaya that's why most po of the drug that are being administered via oral, we are referring to oral, yun yung tinatawag natin that it pass through first pass effect. Kasi if you will notice, if the drug takes place in the stomach, it enters the intestine, it pass through pa the liver. So lahat ng oral drugs by principle will lead to first pass effect. And yung first pass effect is yung tinatawag natin, it will balance the composition and the chemical component of the drug as it follows through with the metabolism and elimination. Kaya ang tanong, sir, pag nagbigay po ba kami ng intravenous drug po ba, it will pass through ba dun sa process ng first pass effect? Hindi na. Kasi from the vein, it will pass through directly to the next phase of the circulation. So I will continue the video for to have a deeper and simple understanding.
So I'll draw a set of axes.
Here comes the
And on the
axis again.
y-axis, we have blood concentration of drug. And on the x-axis, we have time. We'll begin with the most common route of drug administration, which is orally. These drugs move through the digestive system and get absorbed by the gut. Then they move through this whole system. That is, the liver, the venous circulation, the heart, the lungs, back to the heart, and then to the arterial circulation. This takes quite some time. So what we see is a slow rise in the blood concentration and then a slow fall. Note that the Cmax is quite low and the Tmax is quite large. We'll now contrast that with intravenous administration. Assume that we give the same dose of the drug intravenously. And for those who have read ahead, this drug does not undergo first-pass metabolism. In intravenous or IV administration, the drug doesn't have quite such a long journey to reach the arterial circulation, as it only has to go to the heart, the lungs, back to the heart, and then to the arteries. This results in a quicker rise of drug concentration, which might look something like this on the graph. Note that the Cmax is larger and the Tmax is smaller.
Okay, if you will notice from the graph, the first graph that we have mentioned is when the drug is given orally. So if you will notice, if the drug will be given orally, it will pass through the GUT, liver, vein, heart, lungs, artery. So it means the time is prolonged. Okay? So prolonged time, then when is the time that it will reach po yung peak concentration level? Sa sobrang tagal nung journey nung drug when it's given orally, and magpapass pa yan sa first pass effect, magpaprocess pa yan sa first pass metabolism, dito pa lang po magre-reach yan ng tinatawag natin pag nag-abot na yan sa blood, doon na tayo magsasabi na nasa peak concentration level. And as it flows through the other parts of the circulatory system, doon pa lang tayo nagkakaroon basically ng nagdi-decrease ng concentration level. So that's why if we will try to compare, if the drug is given intravenously, shorter na yung pace na magpa-follow through yung processing of the metabolism. As mentioned in the video, any drug that is given through the intravenous will not anymore consider the first pass metabolism. So, mas shorter yung journey, mas mabilis yung concentration or yung concentration level na mag-reach dun sa peak until it reaches the arterial system. So that's why, as a conclusion, if we will compare the ingestion of the drug via oral and through intravenous, we can conclude that once it reached already the peak concentration level in a short period of time, it means that the intravenous drug may have a faster effect compared to drug given orally. So that's why for emergency situations, why not we're not giving oral? We are more giving intravenous since it's emergency. So if you will give an oral drug, it will take time pa to resolve the health condition and possibly it may reach aggravation. But since it is emergency, We need to attend it immediately. It could be life-threatening. It could danger the life of the patient. So that's why we need to have a drug that may have the fast effect. So that's why it is more conclusive that we give the drug through intravenous. So before I continue, do you have any question in mind? So our chat box is open for questions. You may raise your hand or you may unmute if you have any question. So just for me to be confident, if the discussion is cleared, can I see thumbs up again to everyone if the discussion is smooth and clear? Okay, I'm seeing thumbs up. Thank you so much. How about for the others? Okay, thank you so much. So let us continue on the other way around. How about if the drug is given direct to the lungs? Sir, do we have drugs that will be directed to the lungs? Yes. Diba? There are drugs that are given through inhalation, right? There are drugs that are given through nebulization. So the drug will not pass through the blood vessel, but it will pass through the lungs. And if you will try to see the process, it will not pass through the vein, it will not pass through the right side of the heart, but directly. So the shorter the pace itself, it means that the shorter the time that it will reach the peak concentration level, and the time frame is also shorter because it will reach already the arterial system. So let us continue the video.
Even though the dose was the same, this is because IV is a more direct route of administration than orally. Now contrast this with inhalation of a drug. Let's again assume that we have given the same dose of the drug as the last two examples, but this time we are giving it as an inhaled form. Many anesthetics are actually given this way.
Anesthesia.
The drug now only has to go to the heart and then straight on to the arterial circulation. This means we will see the concentration of the drug shoot up very quickly. So note the much larger Cmax and the even smaller Tmax via this route of administration. Also, remember that in all these three examples, the dose of the drug was identical, only the route of administration changed. So you can see how different routes may cause a radically different Cmax and Tmax. This is important when considering the applications for certain drugs. For instance, if you need pain relief quickly, then an IV analgesic will get into the system much quicker than an oral one. Conversely, a drug which has side effects at high concentrations may be toxic if given intravenously, but the same dose might be safe if given orally. Now I have three more points I want to make. Firstly, note that the area under the curve is the same for all these routes of administration. This is because the amount of exposure to the drug, that is, the dose, is the same. Just some routes of administration spread the dose out over a greater length of time. Secondly, you might be wondering why the same drug is excreted at different rates, or more simply, why curve number 3 falls quicker than curve number 1. Without going into too much detail, I have chosen to show a drug that conforms to first-order kinetics.
Okay, as mentioned, the choice of drug have with the 1, 2, and 3 have the same properties. Okay, same properties, but of different form. What do you mean by different form? The number 1 is through a form of a tablet or a capsule, but the same drug and dose are given, but the route of administration is different from the other. Number 2, same drug that are being given and same dose, but the difference is that of the route of administration is directly given in the blood vessel. Third, same drug and same dose, but the difference is that of the route of administration is via inhalation. If you will compare, if you will try to consider the reference from these anatomical processes, The number 3 has the what we call shorter time that it reaches the peak concentration level. What is our conclusion? It's because it already reaches the lungs and the shorter period that it will reach the artery. So it means shorter time, peak concentration level, it reached. So the half of the peak concentration level and the half of the time that we considered here is the what we call half-life, because we have considered the 50%. If we will try to consider in the intravenous, from the intravenous, this is the number 2 slope. So the intravenous, this is the peak concentration level. So meaning half of it, half of the concentration level, and half of the time that we have considered for intravenous is the what we call half-life. More than that, if it is oral, we have here the time that it reaches the peak concentration level and the maximum concentration, and half of it is the half concentration, and this is the peak, then the time, the half of it is a consideration with the half time. So that is half-life of the drug, 50%. So what's the conclusion? The shorter pace that it will reach the arterial, the higher chances that it may have a shorter time, faster effect, and it may reach immediately to the concentration or blood concentration of the drug. The more that it reaches the assurance of peak concentration level, the faster its effect of the drug. So on this perspective, let us continue with our discussion. Now, when we talk about the absorption, always remember that we have different administration site. As what we have mentioned, the administration site could be oral, it could be direct to the blood vessel, it could be direct to the heart, it could be via inhalation, which is direct to the lungs. So that is the administration site. For every drug, it always passes across tissues. So what are those tissues that we're talking about? It passes through these tissues, then this is the means on how it will reach the systemic circulation. From the processes, how we consider the drug movement. What is the end point of the drug movement when it comes to absorption? It is when the time that the drug reaches already the plasma. So that's why administration site, always remember the movement of administration site passes across tissues until systemic circulation. That is what we call absorption. Usually, the degree and rate of the drug absorption may depend on the following. Number 1, administration route. So we have mentioned that if it is oral, the rate of drug absorption is what? Longer. Okay, longer yung before it will take its effect, because it will pass through from the GUT before it reach the arterial system. How about for the intravenous? So we may consider and conclude it has a faster effect because it already considered in the plasma and shorter pace to reach the arterial system. Moreover, if it is inhalation, that's why one of the example in the inhalation is referring on the general anesthesia, which is the anesthetic that could be inhaled. Once it is inhaled, then it may have a fast effect of the anesthesia, the inhaled anesthesia, because it is direct to the lungs and shorter period to peak concentration level and reach the arterial system. So that concludes on how we understand drug absorption. There is also consideration that the degree and rate of drug absorption may affect or it is related to patient's age and physical condition. Example, if you have recalled the video presentation, what are the system of the body that had been involved in drug absorption? We have the GI, we have the circulatory system, we have the respiratory system. If the condition of the individual or any individual have been identified with problems with the respiratory, problems with the blood, problems with the circulatory system, that will affect the degree and rate of drug absorption. Typical example, if the patient has anemia, what do you mean, sir, by anemia? Anemia is a condition of the red blood cell wherein there is a decrease in the hemoglobin and hematocrit. What does it mean? It means that the oxygen concentration level is decreased than normal and the volume of the blood is decreased than normal. So do you think the volume of the blood and the oxygen level is associated with the expected time that the drug is taking its effect? The answer is definitely yes. The lesser the blood that the patient may have, the chances that it may delay absorption of the drug because we have expected volume of blood that supposedly circulate to reach the arterial system. As simply as that. Another example, how about if the patient has obstructive lung disease? For example, in the lungs, it obstruct the capillaries, okay, the pulmonary capillaries. The pulmonary capillaries are the ones responsible for gas exchange. It is where the capillaries that is attached with the alveoli to process gas exchange. Moreover, this may affect in a sense that if there will be obstruction of the pulmonary capillaries, do you think it will affect gas exchange and may not turn the venous blood, which is unoxygenated blood, to oxygenated blood? Try to think of it. Then, I know for a fact that you are thinking the same with me. This will affect the oxygenation level of the blood because the gas may not pass through or may not diffuse efficiently to convert unoxygenated blood and to oxygenated blood as expected. So will this affect significantly the drug absorption? Yes, because oxygen is very important for the tissue and cellular function. The absorption will not take place takes its place if the cells and tissues are deprived from oxygenation. Okay? Another, patient's age. What about, sir, with the patient's age? If, for example, compared to elders and compared to children, which of the two population group may have a slow metabolic activity? You can type in the chat box. I have a question now. Either of the two, a pediatric client and an elder, which of the two? I have a question now, have it in the chat box. Which of the two, pediatric and client, have been identified with slow metabolic rate or activity? Start now posting your answers. Okay? The question is that of which of the two population groups, the pediatric or the elders, do have a slower metabolic activity or rate? So I'm seeing answers 2, 3. Okay, we have 4. Okay, more answers. I want to know what is in your mind because later on we'll try to connect it. Continue to have your answers. Okay, good. Okay. Okay, good. Okay, continue to answer. Oh, good. Very good. I have seen an answer with rationalization. Very good. Very good. Okay. So continue. Okay. So is it pediatric or the older adults? Okay, all the older adults. So which of the two have a slower metabolic activity? So I want to hear from the others. Please continue to post your answers. Okay. Okay, continue. Okay. How about the others? How about the others? We are having 15 responses. How about the others? We are 22, so I expect 21 responses. Okay, more? Okay, let us now conclude. It is a consideration that in the increasing age, the chances that the physiologic changes may have slow metabolic activity. Okay? Do you know that the metabolic activity is very important for the cells to function? And the cells are very important because they do have electrical charges. These electrical charges are very important for what? Nerve transmission. If we say nerve transmission, it is transmission of signal. In this situation, if the elder may have slow metabolic activity, it is directly associated also with decreased cellular activity. If there will be decreased cellular activity, there will be also decreased electrical impulse transmission. If there will be decreased electrical signals or transmission, do you think it will also delay absorption? Yes or no? I want to hear from you. From elders who may have decreased metabolic activity, it could be associated with decreased cellular activity. It could be related on how this metabolic activity will decrease also the response of the person and may cause the delay absorption. Do you agree with me? Thumbs up if you agree with me. And if you have objection, I want to hear from you of the explanation if the explanation is not clear. Okay, so majority have agreed that on the perspective that the elders have slower metabolic activity, it is directly associated also that drug absorption is also affected. Okay, another, letter C, lipid or water solubility of the drug. What do we mean by that? If we say lipid or water solubility, usually ito po yung capsulated and the one that are considered tablets, right? Some of the tablets are water soluble. If we talk about solubility, it means it can be easily break down through what? Through water. Okay? Through water. It's soluble. It could easily be break down. If it is lipid soluble, it means that there could be hindi naman delay but a slow breakdown of the chemical component. In this situation, most of the drugs that are being given with the lipid soluble drugs are those drugs that may basically have action of mga longer effect. Why longer effect? Because the solubility itself acts upon on how it will not aggravate the situation. While for water solubility, these are the drugs that are easily break down and may need fast absorption for the circulation. So the lipid soluble drug and the water soluble drug differs from each other because it will also affect the drug absorption. Letter D, potential interaction with other drugs or food. Okay, have you heard about that there are some drugs that can't be mixed with food? Are there any drugs that once taken must not be mixed with a beverage? Class, for example, if the drug, for example, is oral and you will take a highly acidic beverage. If, for example, try to consider the stomach has hydrochloric acid. The hydrochloric acid is the one that helps in the synthesis and breakdown of the drug. Now, if you will mix it with highly acidic beverage, then this will cause the premature breakdown of the drug. And it will not cause its desired effect as expected. Just a typical example, there are drugs that must not be mixed also with milk. Some of you are doing this because you don't like the taste of the drug. So that what you are doing is you are mixing it with the milk or you are taking it with the milk. Do you know that there are some drugs that could cause counteraction by the lactose brought about by the milk? That may significantly cause absorption problem. Okay, so that is very important when it comes to drug absorption. Okay, next is I know if this concept had been introduced to all of you when it comes to medication administration routes. When it comes to the skills demonstration, I know that some of this concept had been introduced to you in your fundamentals of nursing. Am I right? Okay. Now let's go back and let's refresh ourselves when it comes to how the medication administration routes really affects absorption. We have the what we call enteral routes and we have parenteral routes. If we say enteral routes, these are the drugs that are directly absorbed by the gastrointestinal tract. These are enteral routes. Now, if we are talking about parenteral routes are drugs that are being absorbed outside gastrointestinal tract. It could be muscle, it could be skin, it could be direct to lungs, it could be direct to the specific organs or rather the eyes. So as long as it will not pass through the gastrointestinal tract, then that is what we call parenteral routes. So in enteral routes, we have oral, buccal, sublingual, and rectal. We'll review about these enteral routes. Similar or same also with parenteral routes. We have outside the gastrointestinal tract. We have intravenous. Okay, it's within the blood vessel. Intramuscular, it is through the muscle. Subcutaneous tissues, these are tissues that is considered as part of the administration of the drug. Otic, it could be via the ear. Conjunctival, it is through the conjunctiva of the eyes. Nasal, if it is through the use of the nasal area. And in by inhalation, the absorption or the inhalation itself is direct to the lungs. Then the topical itself considers this effect on the skin. Let us now continue on how it will facilitate your understanding when it comes to this perspective. Let's start with enteral routes. If you can still remember this. If we have considered oral, I just want to give you a mnemonic for you to remember. If we're talking about oral, remember two kasgip. Okay, this is just a mnemonic. Later on, I'll explain to you what two kasgip means. Two kasgip. Two, ibig sabihin two C's. Okay. Oral has two C's. It is common and convenient. Okay? Two C's. Letter A. AS. AS meaning absorption is low. So that's why, as what I have mentioned, the absorption is low because it will pass through the stomach. And it may depend pa on the action of the stomach when it comes to hydrochloric acid level. There are some situations like, di ba, there are drugs that must not be taken on an empty stomach. Why? Because of the chances that the hydrochloric acid itself is at its peak level and may cause gastric irritation. That's why most of the oral drugs may really be taken with full stomach because this cause particularly gastric irritation. Okay? Next, P, usually the route or the medication administration route, which is oral, is the typical route for pain medications. Okay, what are those preparations? We have tablets, capsules, pills, powders, or liquids. So let's go back again. What the two kasgip mean? Two C's. C, common. Another C, convenient. AS, absorption is low. GIP, it causes gastric irritation. And P, pain. Usually the route for pain medication. Any questions so far? So that is what we call two kasgip. Okay, two kasgip. The two C's, AS, GI, and P. Okay, so that is what we call oral. Next, Let us now proceed of what do the buccal means. When we talk about the buccal, you will just remember C-group H. C-group H. What do you mean by C-group H? Let's start. What C means? This usually, the medication takes place in letter C and letter G. Okay. Letter C and letter G. So what do you mean by that? Takes place cheeks and gums. Okay. Takes place between cheeks and gums. What do you mean by pH? Usually, you have the pH because it will require certain level of pH. If we say pH, this is yung what we call concentration. The pH level must be concentrated so that there will be optimal strength to absorb the drug. So again, we have C-group, CG, CGU or CGU, we have preparing the drug takes place in the cheeks and the gums. pH, it may need level or optimal level of pH or concentration. The usual drug, this is based from the literature, the usual drug that are being given through the buccal are for pain reliever for cancer. Usually, pain relievers for cancer are being given buccal, such as fentanyl, so that it will cause its appropriate absorption and be helpful rather than oral. Okay? Kasi sa oral, pagka ang mga cancer usually yan, if they are taking the chemotherapy, usually alter nila yung function ng cells eh. So the hydrochloric acid are not in control. So that's why the safest way of giving the pain reliever via buccal, because it will not pass through the stomach, that will alter the gastric, and that will cause gastric irritation. So let's go back again. How about for the oral? 2 Cas-Gib, 2 Cs. It is common and convenient. So what is the other one? 2 Cas-Gib, AS, absorb slower or slowly. So 2 Cas-Gib, GI. It will cause gastric irritation. P. These are the usual or typical routes or routes for pain medication. C-group. Usually, the drug takes place in the cheeks and gums. And C-group, pH. pH, it may need optimal level of concentration such as pH. I hope you're learning. Next, we have the what we call sublingual. For sublingual, always remember TARBs. Okay, TARBs. So what does it mean? TARBs, T, it is under the tongue. Okay? Then AR. AR meaning absorb rapidly. So, what is the opposite of absorb slowly? It's in the oral. Absorb rapidly or enteral are on the sublingual. Then what is BS? TARBs. B is bloodstream. Meaning, do you know that the blood vessels under the tongue are very rich? Meaning, if there are blood vessels under the tongue, the chances that it will be absorbed to the blood vessels. So that's why most of emergency drugs for chest pain are being given sublingually or under the tongue during emergency. Okay? One of the drug or one of the example of drugs that I am projecting on screen is nitroglycerin. Nitroglycerin is a vasodilator. What do you mean by vaso? Vaso, blood vessel. These are usually given to patients that has a problem with constriction of the blood vessel. If there's constriction of the blood vessel, what is the effect? It will delay blood flow. If it will delay blood flow, it will, and in the blood, it carries oxygen. Do we mean that it also delay oxygen supply? The answer is yes. If it will delay the oxygen supply, then chances that the cells and tissues will be deprived from oxygen. And that will give a signal that there is a problem with chest pain. So that to cause this chest pain or to manage this chest pain, we need to dilate the blood vessel. Nitroglycerins are given, but it is under the tongue. TARBs. T, under the tongue. AR, absorbed rapidly, BS in the bloodstream. Any questions so far? Okay, none. Next, I'm just continuing it because we will end up on the discussion and we will manage na lang yung time for the health break. Now, let us continue. How about rectal? For the rectal, we have, you may remember, RAIT. Okay, RAIT. Okay, let's start. Let us recall nga. For oral, we have two CASGIP. C, common, another C, convenient, AS, absorb slowly, GI, gastric irritation, P for pain. Next, the other is buccal, SIGUP, cheeks, gums, and may need optimal level of pH. How about for the sublingual, TARBs? It is under the letter T, tongue, AR, absorb rapidly, BS in the bloodstream. RAIT meaning that the drug is inserted into the rectum. Do you know that the rectum also is highly vascular? The intestine itself that connects the rectal area is highly vascular. Kaya that's why once it causes any irritation to the rectal tissues, nagbi-bleed kasi highly vascular siya. So sir, greater chances also that it could absorb fast. It could absorb fast. Definitely yes, because in the intestinal tract, we have reached in the blood vessel and higher chances for absorption. So what is RAIT? It is in the rectum and absorbed in the intestinal tract. One of the example, I know you are familiar with this, bisacodyl or dulcolax. Dulcolax is a rectal laxative suppository. This is usually the drug of choice for constipation. Okay? This drug is given and inserted via rectum, and once it will absorb, it will facilitate prevention of constipation. Another one, there is also paracetamol suppository. If, for example, this is usually for children and for infant, if they are incapable of receiving the drug via oral, or if the pediatric patient still do not have the intravenous line, to prevent the febrile convulsion, laxative or antipyretic laxative are being given per rectum. So always remember that ha. Kung talagang nasa peak ng level or peak ng temperature, and to prevent, kasi di ba once it reach yung high level of temperature, there could be chances also that it may affect also the balance by the temperature regulation of the brain. Doon na yun nagkakaroon ng tinatawag nating convulsion. To prevent the convulsion so that it may have the fast effect of the drug, you may have paracetamol suppositor. Okay? So we are done with the enteral routes. So we will now proceed with the what we call parenteral routes. Okay, let's go back. We have parenteral routes. For parenteral routes, let us consider first the what we call intravenous. For intravenous, just remember DOBS. Okay, what DOBS is? DOBS is D. What does it mean? Direct. Okay. A. We have direct access to bloodstream. And what is that bloodstream? We are referring, obviously, intra, inside. And the venous is referring to vein. If we have DOBS, direct access to bloodstream, meaning the drug will be given directly to the bloodstream and may reach the plasma. What are the commonly used way of medication administration? Class, intravenous fluid, or in colloquial, the suero. Yeah, that's why it is called as intravenous fluids, because these are preparations that can be given directly to the blood vessels. Next, we have the what we call intramuscular. For intramuscular, always remember the MLHS-B3. Ang hirap yata nun, sir, Mobile Legend. Nung high school pa ako, B3. MLHS-B3. So what does it mean? What does it mean yung tinatawag natin M? M obviously is muscle. Then LH, less hazardous. And what is S? Usually S is stays in the blood. It stays in the blood longer. And 3, remember ha, the maximum po amount that you may give for intramuscular is only 3 ml. If it is beyond 3 ml, don't take risk. Why? Because it may cause inflammatory conditions if it will exceed 3 ml of the drug that you will administer intramuscular. So again, the maximum is 3 ml. Next, not recommended for 2 areas, ventrogluteal tsaka dorsogluteal. Why? Because there could be possibilities that these areas may have high risk to what? May have high risk to hit nerves. And usually, this may cause a possible paralysis. So that's why ventrogluteal and dorsogluteal may not be recommended for intramuscular due to chances of hitting the what? Nerves, and may cause possible paralysis. So, sabi natin ML-HSB3. So, if it is given intramuscular pala, the longer its effect. Kasi it stays longer in the blood eh. Sabi natin, as long as it stays in the blood, the effect is longer. Kaya that's why for pain reliever, it's either it is given orally. Paano pag may gastric irritation? If you have to manage long-term pain management, usually drugs are given intramuscularly. Okay? But for cancer patient, if we're referring to cancer pain, more are considered buccal. So always take this into consideration. Take note of this because these questions may be considered in the nurse licensure examination. So again, an example po. An example is haloperidol. Haloperidol is an antipsychotic drug. So meaning these are drugs to really to consider the balance with the what we call neurotransmitters that may cause the problem with psychosis. So that's why if for those situations po na meron po mga problem with psychosis or problem with mental deviation, usually ang mga binibigay dito ay through intramuscular so that it will facilitate stability or to sustain po yung kanilang mental condition to a longer period of time. So that is what we call intramuscular. Next is we have the what we call subcutaneous. For subcutaneous, always remember FTSM2. So what do you mean by FTSM2? If you say FTSM2, FT meaning fatty tissues, okay? SM, the fatty tissues between skin and muscle. And 2, okay, kanina in the intramuscular, the maximum amount or volume that we could administer is 3. But for subcutaneous, ang minimum amount or volume po that we could give is 0.5 ml to 2 ml into tissues. So don't give 3 ml. Okay, remember this ha, safety medication, don't give 3 ml if your route is subcutaneous. What could be the problem if you will give it the 3 ml but subcutaneous? Class, this may cause irritations of tissues. Pag nag-cause yan ng irritations of tissues, the next effect is it may cause damage of tissues. Pag nag-cause ng effect sa damage of tissues, it may cause inflammation. Mapamaga ang tissues. Pag nag-cause ng inflammation of tissues, if it will continue, pwedeng mag-lead pa yan sa tissue death. Pag nag-lead pa yan sa tissue death, that is what we call necrosis. And that could be a negligence on the part of the nurse. You need to have the competencies and the knowledge to consider that the 2 ml is the volume that can only be tolerated by subcutaneous. If they will insist or give 5 ml to intramuscular, don't ever try. Your explanation is that of, ma'am, by principle, it can only tolerate, the muscle tissues can only tolerate 3 ml and may cause the possibility of irritation, damage of tissues, it could be muscular tissue death, and may lead to necrosis. Again, necrosis medical term meaning tissue death. So I hope you have remembered what we have mentioned. So let us have a review or a recall. So if we have the enteral routes, we have the oral, we have the two casgate. Letter C, we have the common and convenient. CA, two casgate, we have AS, absorbed slowly. GI, gastric irritation, and usually typical for pain medication. How about for buccal? CGUP. CGUP meaning we have cheeks, gums, pH. It may need optimal level of pH. How about for other than the buccal, the other one is we have the I just missed the other one. What is our third?
Lingual.
Okay, the sublingual. Our third is we have tarbs. So what do you mean by tarbs? T, under the tongue. AR, absorb rapidly to the bloodstream. Very good. Next, how about for the rectal? Remember, right. Right meaning rectal or rectum absorb in the intestinal tract. So these are the enteral routes. How about for the parenteral? Intravenous. Can you still remember the mnemonic for intravenous?
Dubs.
Okay, the dubs meaning, what do you mean? Direct access to the blood stream. Next, how about intramuscular? ML, if you can still remember, ML, HS,
HB3.
B3. So meaning M, muscle, LH, we have less, hazardous. Okay, next. Next.
SB. Stays in blood longer.
Okay, stays in blood longer. And we have 3, maximum of 3 ml. Next, how about for subcutaneous? Subcutaneous, we have mnemonic.
FTSM2.
Okay, so what do you mean by FT? Fatty, tissues, SM, between skin and muscle. Then 2 means 2 ml. Yan, 2 ml maximum but minimum of 0.5. Okay? So these are probably you, wow, sir, are we going to discuss this? These are just a picture. We will not discuss this in details, but it will just give you an overview of our previous discussion. We have the 6 rights of medication that are here. This is because this is emphasized basically as our way of promoting safety of our client. We have the nursing responsibilities. The nursing responsibilities is anchored with the rights of medication. For the forms, I have mentioned a while ago, inhalation, it could be through the metered dose inhaler. Yung MDI or metered dose inhaler as the ones directly pop pag may mga asthma. Most of the time sa mga may asthma, yung mga steroids that are MDI or metered dose inhaler. So mabilis yung effect nun through nebulization. So the solids, as I have mentioned, capsule, tablets, suppositories, and we have the transdermal. So pag transdermal, these are usually topical and this takes effect most from the skin and absorbed through the blood vessels. So for solutions, we have spirits, syrups, elixirs, suspensions. So we may not anymore concentrate on this because I know for a fact that this has been introduced to you during your fundamentals of nursing. Now, I think I may need to end up on this. Okay, I may need to end up on this because as what I have mentioned, we have the direct association of time and the route. So that's why if you will notice, yung intravenous and intraosseous have the time and faster effect. So ibig sabihin, the shorter your time, the chances that it reach already the peak concentration of the drug. So that's why, as what I've told you, the principle itself that the more that the drug reaches the plasma, the time frame itself is shorter, but the fast effect is through the peak concentration level. So if we talk about intravenous, we have 30 to 60 seconds, meaning it just consider a minute, right? So intraosseous, what do you mean by intraosseous? These are drugs that are administered directly to the bone. Okay, 32. Why is it, sir, that intraosseous may have a faster effect and may reach peak concentration level? Because we all know in the bone, via bone marrow, the red blood cells are being produced. So it's still considered of direct what? Direct what you call this? Direct distribution via the plasma. Next, endotracheal. What do you mean by endotracheal? Have you seen patients wherein they have inserted a tube through the mouth and directed to the trachea? Those that are connected to mechanical ventilators or ventilators. Class, those who are subject for operation, anesthesia or general anesthesia are being administered via endotracheal. Similar also for inhalation. For inhalation, if it is directed via direct meter dose inhaler or by inhalation through nebulization. So we can have the effect of 2 to 3 minutes already. For the sublingual, this is the one that the drug being given under the trunk, it will consider 3 to 5 minutes. For intramuscular, 10 to 20 minutes. Can you imagine that, for example, if the patient is in severe pain, the drug itself can manage within the 20 minutes that the patient can tolerate if the drug is given or pain reliever is given intramuscular. Subcutaneous, the longer yung time nito. Kasi if you will notice, it passed through the tissues before it reached the arterial system. So that's why it's 15 to 30 minutes. For the rectal, it could be 5 minutes already to 30 minutes. Then ingestion. Ito yung if you will notice, ito talaga yung matagal. Can you imagine 30 minutes to 90 minutes? So almost ito ay 1.5 hour yung effect bago mag-take yung effect. Kaya that's why if you will attend to emergency situation, ingestion or oral medications could not support the act itself of concluding emergency situations. Yung transdermal, topical ito, it's either ointment or patch. It may vary, it's either minutes to hours. So these principles are very important because when you are attending to your client, you can consider this knowledge or these principles on how you will best explain to your client on how the client will definitely manage his or her condition. Okay? So when we talk about the intubation, correct, this is correct. This is a question. When it comes to the endotracheal tube, so it is inserted via intubation. So you will intubate. The drug, rather the tube will be inserted. Endo kasi meaning inside. And it reached to the trachea. Okay? So I think the time is already constrained as promised because we will continue the discussion. Okay, we will continue the discussion on Thursday. But for the meantime, we ended up on the absorption when it comes to the different routes of administration and how it will affect significantly absorption. The next portion of our discussion will merely consider na po on the other principles and concepts of absorption until we reach the pharmacotherapeutics. So any questions so far? Any question from the group? Thumbs up naman dyan kung walang questions. It means cleared. O baka gutom na. Yun lang yun eh. Physiologic needs. Sabi ni sir, oh, sir, 7 a.m. pa kami gising eh. Tapos hindi pa kami nakakapahinga. I do understand. And I have high respect for Maslow hierarchy of needs. So I'll just stop my sharing and stop recording.